Welcome to our video on understanding positive punishment in EEBAE. In this video, we'll explore what positive punishment is, how it's used in EEBAE therapy, and provide examples to help you better understand this concept. Before we start, positive means stimulus add and negative means stimulus remove. Reinforcement means behavior increase and punishment means behavior decrease. Positive punishment is a response followed immediately by the presentation of a stimulus that decreases the future frequency of the behavior. When a behavior occurs, an aversive stimulus is introduced, making the behavior less likely to occur in the future. For example, if a child throws a tantrum and is given a timeout, the timeout serves as the aversive stimulus, reducing the likelihood of future tantrums. Now we can look what's positive punishment interventions. There is reprimands, response blocking, response blocking and redirection, contingent exercise, overcorrection, restitutional overcorrection, positive practice, overcorrection and negative practice, overcorrection. Let's look concepts and detail of each positive punishment intervention. Spanking involves the application of physical forces as a consequence to decrease for undesired behavior. Verbal reprimand using critical words to decrease undesired behavior. Extra chores is assigning additional household chores or tasks as a consequence to decrease inappropriate behavior. Response blocking is when child throws toys when they are frustrated. Parents quickly physically block the child arm, and it makes child to discourage the throwing behavior in the future. 5. Response blocking and redirection is a child frequently hits their sibling when they are angry. When the child starts to hit their sibling, the parent can quickly intervene by physically blocking the hitting motion and redirecting the child's attention to a more appropriate behavior. Contingent exercise: if a child is caught lying, they may be required to do 10 push-ups. Overcorrection: if a child draws on the walls, they are required to clean the entire room, no just the area they marked. Restitutional overcorrection: if a student damages someone's property, they not only have to fix or replace the item, but also do something extra to make up for it. Positive practice overcorrection: if a person uses offensive language, they are asked to repeat a more appropriate phrase or sentence multiple times to reinforce a correct behavior. Negative practice overcorrection: if a student interrupts the teacher, they are asked to practice staying silent and raising their hand for a set amount of time, reinforcing the desired behavior. Remember, positive punishment should be used with caution and within appropriate ethical and safety guidelines. Now we will look guidelines for using punishment. Select effective and appropriate punishers. When implementing positive punishment, it's crucial to select punishers that are meaningful and appropriate for the individual's behavior. Punishers should be carefully chosen based on their effectiveness in reducing the targeted behavior without causing unnecessary harm. Deliver the punisher early in the response sequence. Timing is critical when administering positive punishment. Punishment should be delivered promptly after the occurrence of the behavior to establish a clear association between the behavior and its consequences. Waiting until the behavior has finished may weaken the effectiveness of the punishment. Punish each occurrence of the behavior initially. Initially, it's important to punish each occurrence of the behavior consistently to establish a clear consequence for the behavior. This helps the individual understand the direct relationship between their actions and the consequences they experience. Gradually shift to an intermittent schedule of punishment. As the behavior improves, it's advisable to transition from continuous punishment to an intermittent schedule. Intermittent punishment helps maintain the effectiveness of the punishment while reducing the risk of habituation or desensitization. Mediate unavoidable response at a punishment delay. In some cases, there may be a delay between the occurrence of the behavior and the delivery of the punishment. It's essential to mediate this delay to ensure the punishment remains effective and relevant to the behavior. Supplement punishment with complementary interventions. Positive punishment should be supplemented with complementary interventions, such as positive reinforcement or teaching alternative behaviors. This comprehensive approach helps address the underlying causes of the behavior while effectively reducing the targeted behavior. Watch and prepare for negative side effects. It's essential to closely monitor the individual's response to positive punishment and be prepared to address any negative side effects that may arise. Negative side effects could include increased aggression, avoidance behaviors, or emotional distress. Record, graph, evaluate data daily. Data collection is vital in behavior modification to track progress and evaluate the effectiveness of interventions. Daily recording, graphing, and evaluation of data. Allow for ongoing assessment and adjustment of the intervention plan as needed. We'll explore the principles and practices that guide ethical decision-making in the implementation of punishment-based interventions. Its task list H5 and related BACB Ethics Code 2. 14 Selecting, designing, and implementing behavior change intervention. First, consistent with behavioral principles. When considering the use of punishment, it's essential to ensure that interventions are consistent with behavioral principles. This means that interventions should be based on the principles of operant conditioning and grounded in empirical evidence. Based on scientific evidence. Interventions should be informed by scientific evidence, including research studies and empirical data. This evidence-based approach ensures that interventions are effective and supported by empirical research. Based on assessment results. The selection of interventions, including punishment-based procedures, should be based on the results of thorough assessments. Assessments help identify the function of the target behavior and inform the development of appropriate intervention strategies. Prioritize positive reinforcement procedures. Positive reinforcement procedures should be prioritized over punishment-based procedures whenever possible. Positive reinforcement is generally considered to be more effective, less intrusive, and more ethical than punishment. Best meet the diverse needs of the client. Interventions should be tailored to meet the diverse needs of each individual client. This may involve considering factors such as age, developmental level, cultural background, and individual preferences. Client's preference. Whenever feasible, the client's preferences and choices should be taken into account when selecting intervention strategies. Respecting the autonomy and preferences of the client promotes their active participation in the intervention process. Also, ethical consideration regarding the use of punishment task list H5 and its related BACB Ethics Code. 2. 15 Minimizing risk of behavior change interventions focus on minimizing risk of harm to the client. Minimizing risk of behavior change interventions. The primary focus of behavior change interventions should be on minimizing the risk of harm to the client. This includes prioritizing interventions that are least intrusive and have the lowest risk of adverse effects. Required review processes. Before implementing punishment-based procedures, it may be necessary to undergo a review process, such as a human rights review committee. This review ensures that interventions are ethically sound and compliant with relevant regulations and guidelines. Continually evaluate restrictive procedures. It's essential to continually evaluate the use of restrictive or punishment-based procedures and modify or discontinue them as needed. Regular monitoring and evaluation help minimize the risk of unintended negative consequences and ensure the ongoing welfare of the client. Now let's practice some mock exam. When Damien doesn't finish his homework, Mom gives him reprimand for off-task homework to stay on task when Mom sees him off-task when Mom is home. Damien will increase his on-task homework, and Mom's reprimand will decrease. What is contingency for Mom's behavior? If Damien increases his on-task homework, and Mom's reprimand decreases the off-task behavior. Therefore, Mom's behavior of giving reprimands for off-task homework is followed by a decrease in Damien's off-task behavior, which aligns with the definition of positive punishment. Mock exam 2. Which of the following is a restitutional overcorrection procedure? 1. Student spills a water on the floor, and teacher asks him to clean up the mess and mop the entire floor. 2. Student spills a water on the floor, and teacher asks to practice safely pouring water into the glass 10 times. 3. Student spills a drink on the floor, and teacher asks him to clean up the mess. 4. Student spills a drink on the floor and is required to run for 10 minutes. Current answer is 1. Student spills a water on the floor, and teacher asked him to clean up the mess and mop the entire floor. 2. Student spills a water on the floor, and teacher asked to practice safely pouring water into the glass 10 times. Is positive practice overcorrection? 3. Student spills a drink on the floor, and teacher asked him to clean up the mess. Is overcorrection. 4. Student spills a drink on the floor and is required to run for 10 minutes. Is contingent exercise. Mock exam 3. Which intervention requires the learner to repair the damage caused by the problem, behavior, and perform additional behavior to improve the environment? 1. Contingent exercise. 2. Positive practice overcorrection. 3. Restitutional overcorrection. 4. Reprimands. The answer is 3. Restitutional overcorrection. Mock exam 4. Which approach involves physically intervening to prevent the completion of a problem behavior? 1. A response, interruption, and redirection. 2. Restitutional overcorrection. 3. Overcorrection. 4. Response blocking. The answer is 4. Response blocking. Mock exam 5. Which of the following is important when using punishment effectively? 1. Selecting random punishers. 2. Selecting effective and appropriate punishers. 3. Selecting rewards instead of punishment. 4. Selecting punishers that are unrelated to the behavior. Answer is 2. Selecting effective and appropriate punishers. Mock exam 6. When using punishment, it is recommended to deliver the punisher as 1. Late in the response sequence. 2. Immediately after the behavior has finished. 3. Only when the behavior occurs multiple times. 4. Early in the response sequence. Answer is 4. Early in the response sequence. Do not wait until behavior finishes. Mock exam 7. Initially, it is best to punish 1. Only some occurrences of the behavior. 2. None of the occurrences of the behavior. 3. Each occurrence of the behavior. 4. Only the most severe occurrences of the behavior. Answer is 3. Each occurrence of the behavior. Mock exam 8. As the behavior improves, it is advisable to 1. Increase the intensity of the punishment. 2. Stop using punishment altogether. 3. Gradually shift to an intermittent schedule of punishment. 4. Use punishment more frequently. Answer is 3. Gradually shift to an intermittent schedule of punishment. Mock exam 9. To minimize the delay between the behavior and the punishment, it is important to 1. Avoid using punishment altogether. 2. Mediate unavoidable response to punishment delay. 3. Increase the delay to make the punishment more effective. 4. Use punishment immediately after the behavior finishes. Answer is 2. Mediate unavoidable response to punishment delay. Mock exam 10. In addition to punishment, it is recommended to supplement with 1. More punishment to ensure effectiveness. 2. Complementary interventions. 3. Rewards to balance the negative effects. 4. Ignoring the behavior completely. Answer is B. Complementary interventions. Mock exam 11. When using punishment, it is crucial to 1. Ignore any negative side effects. 2. Avoid recording and evaluating data. 3. Watch and prepare for negative side effects. 4. Increase the intensity of punishment to overcome side effects. Answer is to watch and prepare for negative side effects. Mock exam 12. To monitor progress and effectiveness, it is important to 1. Record, graph, and evaluate data daily. 2. Record and evaluate data regularly. 3. Rely solely on subjective observations. 4. Ignore data collection and evaluation. Answer is 1. Record, graph, and evaluate data daily. That's all today. If you like this video, please hit like button and subscribe the channel. Thanks for watching.